My name is Dr. David Winslow, and I'm going to describe to you a therapy that we use to help circulatory conditions. It's an oxidative therapy. We're talking about improving conditions that typically our mainstream medicine would use bypass surgery for, or stenting, balloon angioplasty and stenting in the case of the heart. What the first thing you have to understand about this condition is what is actually causing the blockage, what you've heard called plaque in the past, and what most people believe or tend to believe is a cholesterol plug, for lack of a better term. All you ever hear about is lowering cholesterol levels to help your blood flow. What actually is blocking an artery when they bypass or stent it is a tumor. It's a smooth muscle tumor. The wall of the artery is a specialized kind of muscle, so it can constrict and dilate, called smooth muscle. And it is lined by a single layer of cells called endothelium. And anytime this endothelium is damaged, it kicks into this tumor mode, so to speak, what they call hyperplasia. So you get smooth muscle hyperplasia, which is the wall of the artery actually growing into where the blood should be flowing, and this is what blocks the artery. The therapy we use, or that we are talking about here, employs something called a porphyrin. The actual trade name is Visudyne. What that is pharmaceutical grade chlorophyll. These tumors, these atheromas, are highly fatty. They have a lot of lipid in them, so much so that when they scrape them out of like a carotid artery, they'll describe it as being like cream cheese in a lot of cases. So when you put this chlorophyll substance into the blood, it's lipophilic, which means it likes fat. And as it's flowing through your bloodstream, when it comes across one of these atheromas, it draws up into that area and parks, for lack of a better term. Once it's sitting in the atheroma, it starts generating something called superoxide, which is a free radical of oxygen. And many people listening to this might have heard that free radicals are bad for you. Well, they're very bad for the tumor. They actually kill the atheroma. The way it dies is important. It's called apoptosis. That's what they call programmed cellular death. It's the way cells die in your body every day. The reason that's important, as opposed to something like necrosis or rotting gangrene pus, with apoptosis, your body has the mechanisms to clean up the mess as the tumor dies. Your lymph flow, your blood flow, and mainly specialized immune cells will gobble up the debris and dissolve it, so there's no toxicity to killing the tumor. So we've taken 100% blocked old stents, old bypass grafts, and vessels that haven't had anything done to them yet, and opened them wide up using this therapy. Typically, when somebody's taking nitro under their tongue for angina, chest pain from blockage in the heart, after about 5 of these IVs, they no longer need their nitro, which is a good way of telling that it's actually working. One of the laws of blood flowing through a closed circuit of hoses is that you can increase the diameter of the hose by 1/16, and you're doubling the blood flow through there, so it doesn't take a whole lot of, you don't have to kill a whole lot of tumor to actually double the blood flow through the vessel. You start doubling blood flow, and a lot of things like angina will go away. 85% of the patients that come here symptomatically will notice improvement for their circulatory condition. In fact, the majority of them do not go back for objective testing like a repeat angiogram, simply because they know they're better and they've already been through so many catheterization procedures that they're not necessarily all that ready to go jump into another one of those if something like their angina has gone away. But many, too many to count patients over the last 14 years have had repeat angiograms that, 99% blockages are completely gone. 80% blockages become 20% blockages, whatever you want to imagine the improvements might be. Same thing with the carotid arteries. And Doppler studies in the legs, whatever thing, objective testing that they can go through for the different vascular conditions. We've had objective tests that showed that they had improved, or the condition was completely gone. But to tell you exact percentages of that on all the people that I treat is difficult, because so many of them don't even go back for that testing because they know they're better just from their symptoms getting better. And I'm talking about going in there through with an IV therapy and getting rid of the plaque, not just controlling blood pressure, controlling cholesterol, and nutritionally treating them and things like this. I'm talking about going in there and intervening and getting rid of the problem. Well, there's just no comparison between that and having the surgery done. I mean, anybody that's thinking about having the bypass surgery, get yourself a film or pull it up on YouTube or something and watch what they do when they do a bypass surgery.